Welcome to UMCC Medical Consultant Connectors, where your health matters to us. Ever wonder how our bodies miraculously heal after an injury? It's a fascinating process, isn't it? This process, known as wound healing, is a complex symphony of events that restores the integrity of our skin and tissues. It involves several stages, each crucial to our health. From the initial inflammatory response to the final remodeling phase, our bodies work tirelessly to repair damage and fend off potential infections. Stay tuned to uncover the intricate process of wound healing and how to take care of wounds properly. But first, what causes a wound? It's more than just cuts and scrapes. Wounds are usually the result of some form of injury or damage to the skin. They can occur from a myriad of sources, including physical trauma like falling off a bike or getting into a fender bender. Burns, too, are a common cause of wounds, whether from a scalding hot coffee spill or a brush against a sizzling oven rack. Then there are surgical incisions, which are wounds made intentionally by medical professionals to access internal structures of the body. These are clean, precise and controlled, but they're still wounds that need to heal. Lastly, let's not forget chronic conditions like diabetes, which can lead to wounds due to poor circulation and nerve damage. Each of these causes can affect the healing process differently. Some may heal rapidly, while others may take more time and specialized care. As you can see, wounds can come from a variety of sources, but they all kickstart a similar healing process. Now, how does our body mend these wounds? It's quite a journey. In the first stage, hemostasis, the body immediately works to stop the bleeding. Blood vessels constrict to limit blood flow, and platelets form a clot to seal the wound. This is the body's quick fix, like putting a patch on a leaky pipe. Next, we move into the inflammation stage. This is when the body sends out its cleanup crew, white blood cells, to the wound site. These cells not only clear away debris, but also fight off any invading bacteria. This stage is typically marked by redness and swelling, signs that your body is hard at work. The third stage is proliferation. This is where the real rebuilding happens. New tissue, known as granulation tissue, starts to form. This tissue is rich in collagen, a protein that provides structure and strength. At the same time, new blood vessels start to grow, bringing much-needed nutrients to the site. Finally, we reach the maturation stage. This is the final touch, the polishing of the repair. The collagen in the wound is remodeled and reorganized, which can take anywhere from a few weeks to a couple of years. The wound contracts and the new tissue strengthens, restoring the skin to its original state. It's truly fascinating, isn't it? But what happens when things don't go as planned? Unfortunately, not all wounds heal smoothly. Some complications can arise. In some cases, the body's healing process hits a snag, and that's when problems start to emerge. Infection is one such complication. When a wound isn't properly cleaned or cared for, bacteria can sneak in and start to multiply. This can cause redness, swelling, and even pus. It's crucial to keep wounds clean to prevent this. Another potential issue is dehiscence, which is a fancy term for when a wound reopens after surgery. This can happen if the wound wasn't closed properly, or if the person moves too much too soon after surgery. Then there's keloid formation, a condition where the scar tissue grows excessively, creating a raised, thick scar. This happens when the body overreacts to the healing process. So, how do we treat these complications? Well, it depends on the specific issue at hand. For infections, antibiotics are often prescribed to kill the bacteria. With dehiscence, the wound might need to be stitched up again. As for keloids, there are several options, including steroid injections, laser treatment, or even surgical removal. But remember, prevention is better than cure. Keeping the wound clean, avoiding unnecessary movement after surgery, and following your doctor's advice can all help prevent these complications. Proper wound care can help prevent these issues and promote healthy healing. Preventing wounds is always better than treating them. But how can we do that? Start by wearing protective gear when needed and maintaining good hygiene. Keep your skin clean and moisturized to protect against cracks and tears. Avoid picking at scabs or interfering with a healing wound. Summing up, we've delved into wound causes, the healing process and complications. Always remember, your body is a healing machine. Take care of it, and it will take care of you. UMCC, your ultimate medical consultant connector.